Hi, my name is Dr. Jan Tade. I'm a specialist orthodontist and I'll be giving you some tips and advice on how to overcome some common problems you might encounter during the course of your treatment. At the start of your treatment, you would have been advised to watch a video on how to take care of your brace, the foods and drinks to avoid, how to keep it clean, and how to make it feel as comfortable as possible. This will be found on our website. At the start of the treatment, you would have been advised to get a starter pack, and in that the most useful item is wax, which I'll be going through with you during the course of this video. The first set of problems you may encounter relates to the arch wire. In this instance, the wire is sticking out through the back of the brace, like this. What you can do is, in this instance, is to try and push the wire inwards with a cotton bud to push the wire out of the way. If this doesn't help, what you can do is apply a bit of wax from your starter pack onto the part of the brace which is sticking out. If this does not help, what you can use is a pair of clean nail clippers. Cut the wire as close as possible to the bracket, remembering to remove the arch wire that you've cut from your mouth. The other thing that can happen is the wire may come out of the bracket at the end, like this. It usually happens when a bracket has come away in that position, or one of the colors has come away from the bracket that's holding the wire in. What you can do in this instance is you can pick the wire up with your tweezers and place the wire underneath the last tooth, like this. If this is not possible, what you can do is cut the wire with a nail clipper at that point. It is also possible to try and pick the wire up and slide it back into the tube at that point. It can be quite tricky. If you're able to do it, great, but if you can't, then cut the wire at that point. The other problem you may encounter is a bowing of the arch wire, such as this. It usually tends to happen when you've had an extraction at this area. What you can do in this instance is, with a pair of tweezers, hold the wire and jiggle it to try and slide the wire back in through the tube. If this doesn't happen, what you can do is, over the course of a meal, see whether the effects of chewing will allow the wire to slide back in. If after the meal this does not happen, what you'll need to do is cut the wire at that point as close as possible to the bracket, remembering to take out the piece of arch wire that you've cut away. On some occasions, the arch wire may fracture, such as in this situation here. What you can do is apply the wax onto the position where the arch wire is fractured. Some patients may have a coil such as this on their brace. If the coil starts to unravel, as it has in this case, you can push the coil inwards towards the teeth to keep it out of the way. It may be the case that as time goes by, the coil will continue to unravel. If it does so, then you can very gently help unraveling the coil so that it does not cause any further problems. In the worst case scenario, if a wire is causing major problems, you can grip the smallest part of the wire and try to slide it out, such as this. The next set of common problems you may encounter relates to the brackets. Sometimes the bracket may come off the tooth, such as in this instance, where it slides from side to side. You may leave the bracket as it is if it's not causing any problems. Sometimes the bracket may flip over. You can try to flip the bracket the right way around and slide it back towards the tooth where it belongs. If the bracket comes away completely from the tooth, please remove the bracket out of your mouth, keep it safe, and leave it as it is. If a bracket is rubbing, and it tends to usually happen where there is a hook on the bracket, such as in this instance, you can apply wax onto the tooth and the bracket like this. You may find that during the course of the treatment, your gum may swell up in any particular area between the brace. It is usually because oral hygiene is not as good as it needs to be. So it will be important for you to angle your bristles of your toothbrush and brush along the gum line to make sure that these areas are very clean to reduce the swelling of the gums. These are modules which are used to hold the wire onto your brace. If any of them do come off, don't worry, this can be dealt with on your next appointment. The other thing that can be applied on your brace is a power chain, and the ones we tend to use are clear, but in this instance I've shown you a silver power chain. You may get a fracture at any point of the power chain. If it's not irritating you, you can leave it as it is. There are also E-links that we use, and these are used to close spaces. Sometimes they fracture, and they usually fracture at either one end or the other. If that happens, you can try very gently to remove the longest part of the power chain away from your brace. If you are unable to remove it, cut it as close as possible to the point of origin.